Do you experience lower back pain when you bend yourself forward? Or does your pain start when you are sitting for many hours? If that's the case, then this video is for you, so stay tuned. Hello everyone, my name is Suhan, Doctor of Physical Therapy. Today I want to show you what you can do when you have lower back pain from anterior pelvic tilt. So what is exactly anterior pelvic tilt? It is a pelvis misalignment. The front side of your pelvis is rotating forward and downward, and at the same time your back side of your pelvis is rotating upward. So that pelvis misalignment itself would not cause lower back pain, but lower back pain can happen with disc herniation when you have anterior pelvic tilt. So disc herniation basically means your disc being desiccated and then it pops backward. That and then the backside of your pelvis rotating upward will increase the chance for the disc to compress nerves around it. So how can we fix it? Let's try pelvis rotational motion first. Find your hip joint and go up a little bit higher, and you're gonna feel the bony prominent area, which is going to be iliac crest, the top side of your pelvis. Use two fingers and then grab it over there. And I want you to use your thumb and then grab it at the same height but on the back side. And I want you to slowly bring your pelvis backward and forward for practice. There might be some people who don't even know how to rotate their pelvis. That's okay. Try a few times, and what we're going to be focusing on is to bring the front side of your pelvis rotating upward. And it is important to activate your abdominis muscle, like it feels like your belly button is moving back to your spine as you bring the front side of your pelvis rotating upward. We don't want to bring it back too much because that can lead on to posterior pelvic tilt, which is another pelvis misalignment that can cause lower back pain symptoms. And that's why it is important to practice your pelvis rotating forward and backward to find the mid-range, and we want your pelvis to stay in that mid-range when you are doing daily activities such as sitting for a long time or bending yourself forward. Are those stretching and strengthening exercises around your pelvis important? Yes, they are important and beneficial. However, those exercises itself would not correct the posture deviation. And that is because your posture is formed in the habitual movement pattern. Let's say you had a desk job and then you had a lot going on your right side, so you got a habit of leaning more towards your right when you're working. And now you notice this, so you want to fix it. So just like you're fixing for anterior pelvic tilt, by exercising, you strengthen your left side of your body and then stretching your right side of your body. Does that sound reasonable to you to fix it? No, it's not. You simply have to be aware of the fact that you're leaning towards your right side, so you just have to lean towards your left. So just like we're fixing for anterior pelvic tilt, we have to be aware that your pelvis is rotated forward, so we have to practice for rotating backward. But what's helping for strengthening and stretching exercises is helping you for staying in that right posture with minimal effort. So we still want to do some exercises. Thank you for watching. I'll upload for another video talking about all those exercises. Thank you. Bye-bye.